behavioral or developmental disorders. Now, these are commonly witnessed in children at various stages of growth. Children are usually unable to cope with the stress and are unable to explain the stress to the adults. The things that appear very minor to adults are very big for kids, and therefore these behavioral or developmental disorders start to take a root at the very early age or the very early developmental phase of the life. Now, these behavioral or developmental disorders can be broadly categorized into two forms: externalizing disorders and internalizing disorders. Externalizing disorders are those disorders where a person is in a kind of uncontrolled behavioral situation where there is a aggressive phenomena that is to the others in the environment of the child. So the child is not creating problem for oneself but for others around, and this is a externalizing disorder. Internalizing disorder is a disorder where child starts to become uncomfortable within themselves. So there could be anxiety, depression, discomfort within the mind of the child. It's not outside. And this is a internalizing disorder. So both these kind of disorders are commonly seen as the child grows across various stages. The behavioral and the developmental disorders are very common. We can classify those under 6 basic categories. Those are the attention deficit hyperactivity disorder, oppositional defiant disorders, conduct disorders, anxiety because of separation, pervasive development, and eating or intellectual disabilities. To begin with, the attention deficit hyperactivity disorder. Now, there are two basic characteristics with these kind of children. There is insensitivity and there is impulsive hyperactivity. Even if you would ask the child to sit, the child would keep on jumping on the table, dropping up the things, hitting the things, and this would be a constant non-stop phenomena. And this is attention deficit hyperactivity disorder. The levels of high activity are high, attention span very low, and therefore constantly in motion, climbing, jumping, sitting, dancing, eating, throwing. So there is a kind of constant motion that would be seen in the series of activities, highly inattentive. So this is a attention deficit hyperactivity disorder. The next is a oppositional defiant disorder. There can be various kind of antisocial behaviors or conduct behaviors which can be seen, and the person is totally against what is there. So these lead to aggressive development in personalities, and these aggressions can be into various forms. There can be verbal aggression where person speaks all bad names, a physical aggression where hitting, fighting is commonly seen, a hostile aggression where injuring someone else become a common habit, proactive aggression, that means trying to bully others without any reason or without any marker, and that is proactive aggression. All of those are kind of oppositional deviant disorders where a kind of disobedient, irritable behavior is commonly witnessed in the children. These children tend to develop into aggressive personalities. In cases they are not aggressive and turn out to be non-aggressive, they could lead to sometimes violation of rules. Sometimes they can even lead to damage of things, damage of property, damage of individuals, and therefore needs to be properly handled. The next is separation anxiety disorder. The children in this phase are unable to internalize themselves, and therefore internalizing disorder where the child gets very panicky about certain happenings. For example, if the parents go for job and leave the child behind, or if the child has to stay at some other place for 5-15 days, there is a sadness, unresponsiveness that could be seen in one, and there could be withdrawal symptoms that can be seen. So very young children usually have sadness, fear, anxiety as a common response to it. They appear themselves, or they keep themselves withdrawn from the natural surrounding. As they grow older, they become argumentative. They become highly argumentative, and at the later stage, they have a feeling of guilt or hopelessness. So, this anxiety and panic of separation is something, a constant fear in that mind. The next is pervasive developmental disorders. Now, here, communication with the social space is hampered. Autism or autistic disorders are common form of pervasive development disorders. We have seen that 70% of the children with autism can be classified as mentally retarded. So they are unresponsive to the feelings, they are unresponsive to the happenings, the emotions around, and they are even slow performers in school. So if a child is unable to cope with a regular syllabus, the regular school standard in which the child is, there is a pattern of repetitive behavior, a narrow pattern of interest areas which are shown. Those are all signs of autism. Now, autism kids usually have marked difficulty with interacting with others, communicating with people. They have very small and restricted areas of interest. They are very particular about their daily routine habits and have a strong desire to keep themselves in a routine habit. Anything which is outside routine, they are not comfortable with. So those are the pervasive developmental disorders. Again, we do have eating disorders. One of the eating disorders is known as anorexia nervosa. Here, a person tries to willingly keep themselves hungry. Hungry in the sense that they have a constant fear of getting overweight, and therefore they won't eat. And this is anorexia nervosa. The next is bulimia nervosa. Bulimia nervosa is a person would keep on having excessive amount of food, and then once they have excessive amount of food, they would have all the medicines in order to remove that. So there could be diuretics, there could be laxatives, there could be any other form of, let's say, vomiting that could be done, but constantly eating more is important, and that is bulimia nervosa. The next is binge eating. Binge eating is frequent episodes of out of control eating. So normally a person would eat normally, but there would be sudden cases where the person would start to gulp a lot of stuff, and then again leave it for a while, and then there could be episodes of sudden eating, and this is known as binge eating. So these are known as the eating disorders. And then definitely intellectual disability, where a person has an IQ of equal to or less than 70, we say there is impaired adaptive behavior, and there could be lack of interpersonal skills, functional academic development, that intellectual and academic development that can be seen, and therefore impaired adaptive behaviors are commonly witnessed. So these are some of the common behavioral and developmental disorders commonly witnessed among children, and therefore important to note.